Mr. Jones, you still on here?
Yes.
Okay. You gave us an anecdote before concerning an overprescription of painkillers. And I think we've made a lot of progress on that in the civilian sector. Do you feel there are problems there in the military where they maybe haven't caught up on the amount of painkillers you could prescribe? Or, like I said, I believe in the last 4 or 5 years we've made so much progress. But could you comment on where you think the military is on that?
My friend, first of all, real quick, multiple members of this committee have asked about stigma, and I just wanted to really, if I could touch on that real quickly.
Sure.
As the one person on this panel that I know, General may have, but I was a troop, a low-ranking enlisted. Stigma, that's a cultural problem, not an administrative problem per se. And what I mean by that is you're not going to solve that problem with a PowerPoint and a policy. You're going to solve that problem by going where you make leaders and ingraining it into leaders to treat their troops in a way that they can communicate with their troops about problems. It's a one-on-one conversation, not a classroom conversation, that removes that stigma and gives service members the opportunity to be honest about what they're going through with people around them. It's cultural, and it's the hard way, not the easy way. Not that let's write a policy and make a PowerPoint that everyone gets once a year. It's when we make leaders, we instruct those leaders on how to communicate with their troops and do things, just like the general was saying, where we change the perspective from I can play hurt to I can play a heck of a lot better fully healthy. And back to your question about painkillers, the anecdote I gave, the friend I had was being prescribed by the VA. I can't really speak in this moment how the DOD prescribes painkillers because I didn't even consider it an option when I was in the military. I didn't even know that was even something I could get. But with the VA, the problem there that my friend had and still persists is the lack of communication between a physician in the VA assigned to mental health and the primary care manager for that service member. I belong to a VA in Atlanta. I've had so many different primary care physicians at the VA that I couldn't name them. I finally found one that I trusted and believed in. And when I went in for a monthly checkup last month, I was notified she's no longer there. And so all that trust I built with that physician, she's not there anymore. If I went to a physician out in town, they've been there for 30 years. And so that's that type of trust, communication, and that primary care physician understanding everything that veteran is dealing with. That's the problem, because that primary care physician will be in charge of issuing me pain medication. And that's the person that would know I'm also seeking mental health or dealing with mental health issues. I went to the VA when I first moved to Georgia, and the doctor literally sat there at the computer and asked me these questions like, have you thought about killing yourself? He never even looked away from the screen or introduced himself to me. I don't know anyone in this world that feels comfortable revealing that information to someone who has yet introduced themselves or even look them in the eye. These are cultural problems. They're not something you just simply solve with a change in policy. It's a full education and cultural shift. And that's why I'm such an advocate for what is usually a much more intimate interaction with nonprofit organizations and private healthcare providers that want to work in concert with government entities like the VA, not aside from. They're being forced to work on their own. They want to work in concert with, and I think that it's the responsibility of you all to help make that happen.
Thank you.
The gentleman.